Assalamu alaikum. Today, the purpose of presenting this video was an extremely unexpected and unusual location of the bladder stone. This 80 years old patient underwent transurethral of resection of the prostate around 8 to 10 years back, and now he presented with moderate to severe symptoms which had hematuria as well. So he presented basically with hematuria, and these are the findings of cystoscopy. The ultrasound showed 23 millimeter stone. The X-ray KUB also showed 23 millimeter opacity. Yet by doing a cystoscopy, we found that the bladder was severely trabeculated. So we looked for the stone within the diverticuli. There were multiple small open mouth diverticuli, and the bladder was severely trabeculated. However, the capacity was normal. The urethra was normal. The prostate was having a mild occlusion, and there was suspicious growth on the left posterior lateral wall. So after not finding the stone, we decided to resect the prostate and just remove some bit of obstruction which is there. As the patient was in spinal anesthesia, I discussed with him in detail that we were not able to find the stone, so we started resecting the prostate to make way for his and we also decided that after completion of the resection of the prostate, we'll be resecting the area on the posterior lateral wall and we will send it separately for histopathology to rule out any transitional tumor. But here you can see the arrow that we found the stone. It was badly stuck inside, embedded inside the mucosa and the prostatic parenchyma. So there was no other way to retrieve the stone, so we tried to resect the parenchyma so that we can reach to the base of the stone and remove it. Meanwhile, the cutting loop is also very old, and so I decided to keep on resecting with the same loop, as I knew that if I take the new loop, the new loop will also be broken. So it's okay if we broke and wasted this cutting loop. So we kept on resecting the mucosa, and we tried to mobilize the stone. While mobilizing the stone, as you can see, that stone is being fragmented. So these small fragments can then be removed by ilex evacuator, as in this situation that half of the prostate is resected, so there is a little bleed as well, and there is a vascular mucosa on the posterior lateral wall, the left posterior lateral wall. So using a stone punch in this situation will be very tricky and difficult. So my aim was to mobilize the stone and make it drop into the bladder, and also at the same time being converted into small pieces so that I do not have to use the stone punch, and the stone can be removed with the ilex evacuator. So as you can see here that the loop is already broken, so using another loop here will be just a waste. So I kept on going with the same loop. At the same time, using diathermy at the base of the stone where it is stuck into the parenchyma, the stone became progressively loose on the mucosa. So I was able to rotate the stone along the bladder neck like this. Here you can see that I'm trying to rotate it, and now I'm successful in rotating the stone. So this maneuver mobilizes the stone even more, and by the end at the base of the stone, I'll be using the diathermy. Here it is now totally changed the position from the anterior position. It has dropped down onto the left lateral position, and now I can feel the base of the stone within the parenchyma. So the main aim of presenting this video on my channel was that the ultrasound showed a stone, and we repeated the ultrasound as well, and it confirmed the presence of a 23 millimeter stone in the bladder. The prostate was measured on ultrasound to be 130 grams, and you can see that it is occluding, but this 130 grams on ultrasound means a distance between point A and B, so the lumen is not that much occluding. So it was lucky that we decided to resect the prostate. So the stone is now dropped into the bladder, which will be removed later on with the ilex evacuator, and we changed the loop, and we made hemostasis and did coagulation of the blood vessels which are bleeding, so that the vision becomes better. So if we did not resect the anterior lobe of the prostate, and the patient later on performed an ultrasound, and if it was found that there is a 23 millimeter stone, that would have been a disaster. So always look for stones here and there. Here I would like to mention an important thing, that one of the sonologists also mentioned that the stone was stuck at the meatus of the prostate, or the bladder neck. So the resection is now complete, and we are doing coagulation. Thank you very much for watching this video.